Drugs have taken over the lives of many people, including some of the most famous celebrities. Drugs become a source of dependence for many drug users. Two types of dependence exist: psychological dependence and physical dependence. Physical dependence occurs when cessation of use causes physical withdrawal symptoms and readministration alleviates those withdrawal symptoms. Some of these symptoms include an increase in heart rate, an increase in blood pressure, sweating, tremors, confusion, seizures, and hallucinations. Psychological dependence occurs when drug acts as a reinforcing property, or makes you feel good, and alleviates the unwanted psychological or emotional withdrawals. Different drugs allow dependence of both types, such as morphine, heroin, and alcohol. A narcotic drug is classified as a substance that brings relief from pain and produces sleep, an analgesic. Examples of narcotics are poppy seeds, morphine, and heroin. Heroin produces a high that is accompanied by drowsiness and yet a deep sense of well-being, yet this feeling only lasts a few hours. A number of narcotic drugs are not naturally derived from opium, yet they have similar physiological effects on the body, so they are referred to as opiates. An example of this type would be OxyContin. Hallucinogens are drugs that can cause marked alterations in mood, attitude, thought processes, and perceptions. The most controversial drug of this type is marijuana. Today, marijuana is considered the most widely used drug in the U.S. Believed that it was smuggled across the U.S.-Mexican border, marijuana took its first stronghold in Texas. The drug appears to have no dependence effect on the users, but the long-term users do suffer amotivational syndrome, where they are characterized as apathetic, having impaired judgment, memory, and concentration, and having a loss of interest in personal and conventional goals. Other hallucinogens include LSD and PCP. LSD produces drastic changes in mood, from laughing incessantly to crying with the smallest provocation. Physical dependence usually does not occur, but an individual may suffer flashbacks and psychotic reactions. PCP can be smoked, ingested, or sniffed. The effects of this drug are superhuman strength, invulnerability, detachment, unresponsiveness, confusion, and agitation. Depressants are drugs that produce a depressant action on the central nervous system, such as alcohol and barbiturates. Alcohol can inhibit the mental processes of judgment, memory, and concentration, leading to a reduction in coordination, irritability, unconsciousness, which could then possibly lead to a fatal depression of circulatory and respiratory functions. Barbiturates are considered downers because they create relaxation, a feeling of well-being, and produce sleep. Physical dependence can develop if barbiturates are excessively used. However, most are prescribed as sedatives and muscle relaxants. Stimulants are considered drugs that stimulate the central nervous system by increasing the heart rate, blood pressure, and pupil dilation. Some examples of stimulants are amphetamines, cocaine, and club drugs. Amphetamines are commonly referred to as uppers because of their stimulating effects on the central nervous system. These drugs usually provide feelings of well-being, increased alertness, decreased fatigue, and a loss of appetite. Various forms of amphetamines exist, such as dexedrine, methamphetamines, or ice. Cocaine was first observed through the work of Sigmund Freud. It is considered to be a very powerful stimulant by increasing alertness, suppressing hunger, fatigue, and boredom. Club drugs are synthetic drugs used in nightclubs, bars, and raves. Examples of these types of drugs include ecstasy, GHB, roofies, and methamphetamines. The effects of these drugs are euphoria, relaxation, disinhibition, and increased libido. Roofies exhibit effects such as muscle relaxation and loss of consciousness and memory. Federal law establishes 5 schedules of classification for controlled substances on the basis of a drug's potential of abuse, potential for physical and psychological dependence, and medicinal value. Criminal penalties for unauthorized manufacture, sale, or possession of controlled substances are related to the schedules as well. The most severe penalties are associated with drugs such as heroin, marijuana, and LSD. Drugs have become an important aspect in medical treatment. However, when people abuse those drugs, the effects can be fatal.